Greetings. On August 31st, I put out a video where I asked the question, would you sign up for a healthcare revenue cycle course? And I put it up here on YouTube, and I shared it on LinkedIn. I shared it on Twitter. And I had some people who said, yeah, they'd be interested in looking at something like that. So I've decided that as of the beginning of the year, I hope that I will be starting this full membership site. And the way it's going to be, because I've talked to a lot of different people who know about creating membership sites, not necessarily healthcare, it will actually kind of look like the blog. I have a site that I already have. I've had it out there for a long time. It was called Medical Billing Answers. And I answered questions for, well, regular folks who aren't in healthcare. I answered questions for people who are in healthcare. And I talked about other things because blogs work better when they have content. They were related to health, but they weren't related to, well, what we would be talking about. And what I learned is that you can set it up using the blog by creating different passwords for people and giving them certain levels. And what will happen is that you would visit the blog, and because you would have this password, then you would see stuff on it that not everybody would see. If you're not a subscriber, if you don't have the password, then you won't see it. You may see anything else. If I put anything else up there, because I haven't put anything new up there in the longest time, but you will at least see those things. And it's going to be one of those kind of things. It's like almost a labor of love. We're going to see how it's going to go. Initially, I am going to charge, I'm going to charge two different fees. I'm going to charge a fee for the first 10 people who sign up. They get a discount. This is a monthly fee, by the way. And so you get that discount for a year, and then it goes back up to the fee that everyone else is going to be charged when they come in. And like I said, it's not going to be cheap. It's not going to be really overwhelming, but I'm going to tell you why. I already know that there's going to be certain individuals who are going to come in, but I have a feeling that if I get lucky and suddenly this becomes a success, then a lot of people who are going to be coming here for the information, or to the membership site, are going to be being reimbursed or paid for it by their employer, which basically says that these folks are going to be getting consulting for a way lower price than I would ever get as a consultant. And so you just put it out there. Also, the first 10 people are getting that discount because when I'm putting information out there, I'm going to get feedback from them, hopefully, on what they think about what I'm sharing, what other things they may want. And it's possible that I might already have that in the pipeline, but it's also possible that someone may ask a question. I may say, well, hadn't really thought about that. Let me put that down on the list as something to create. So it's going to be this symbiotic process. But I wanted to talk here about, well, different things I'm going to cover and how I'm going to cover it. For instance, the first thing is that this is going to go from registration through collections, because registration starts the entire process. Without registration, nothing else happens. And then collections is really the end of it if it gets that far. I mean, if it gets to that point where you've billed insurances and now there's this copay that's left over and no one is paid for it, then, it goes to collection. Or if they never had insurance and now you've had to try to, track down the money, that's collections. It's a whole lot of things that are part of this, and you've got to address it because that's part of the money that your hospital's not getting, and you have to make decisions. Are we going to sue them? Are we going to send it to collection? Are we going to write it off to bad debt? It's stuff that has to be talked about. Now we're going to talk about proper charge capture processes. And this is where you basically go into all the revenue generating departments in different ways and you find out what their processes are. How do they capture charges? Do they have a charge sheet? Do they input it on their own into the computer? Are we sure that everything is mapped properly? You have to ask those kinds of questions because that is really how your revenue is going to be generated. And is it proper? For instance, we're going to talk about charge creation. And charge creation is interesting because I have found that a lot of places, a lot of facilities have created charges that aren't legit. By that, this is just a quick tip. By that, I'm saying that what they'll do is they will put a bunch of things together that are not billable because they're routine, create their own kit or set, whatever they want to call it, and then slap a big fee on it and say, okay, we can bill for this. Well, no, you can't. that's actually against the rules for everybody. Some hospitals get away with that mess, but that's one. And of course, the thing where people are charging extravagant amounts for, well, aspirin, Tylenol, whatever. Stuff you're really not supposed to be charging for to begin with. That's not proper charge processes. It's not proper charge creation. It's the things to look at. We're going to talk about denial management. Why denial management is a big deal. Because one of the things you find out is that if you have a big list of denials, that's a whole lot of money you're not getting. And usually you find out that your first 5, this happens more often than not, your first 5 are probably responsible for 75% of all the denials you get, as long as you're tracking them properly. And if you can fix those, then it's going to help things move along a lot better. You could have a lot of money in just those 5. You want to get them all fixed as much as possible because there's always going to be new ones that are coming down the line. And by knowing what they all mean, then maybe that's something that you teach the billing people, because a lot of times they don't know what these codes mean. They just get something and they will rebill it without really investigating it. So this is, something that you need to know and how to help out. Then we got to talk about understanding AR days. And that sounds really strange, but I found out when I was a director, I'd been talking about AR days since forever. And then one day I was talking about something and they just all looked at me and I said, okay, who here knows what AR days are? And not even my supervisors actually understood what that was. And I said, oh goodness, I got to start this from the beginning. But understanding AR days is not just outstanding AR days. So that's something else to talk about. Then we're going to talk about tips for how you track individual performance in patient accounting, because there are tricks to that. There's a lot of folks who've never done this. I did this. I did this years ago. I got my Excel spreadsheet that I created. I got other things that I put together, and I just did all this stuff because I didn't always want to know how the department was doing. I needed to know how each individual person was doing, seeing if they were pulling their weight. Maybe they needed help, or maybe they were so far ahead of everybody else that I could actually use their services to help do other things. You need to know that. Proper procedure coding and why. And, there's different reasons for this. There are a lot of services where you could use multiple codes, multiple procedure codes, but you might want to pick certain ones. And then you will find some where, and I found this out, where one of the hospitals I was at used a procedure code for these particular procedures that wasn't what that was. But they thought the wording was, that's what that was, and they lost a lot of money. There's a lot of money that they didn't get. And insurance companies never going to tell you when you're doing something wrong. They're just going to pay you based off of what you charge them, if it's in their benefit. If it's not in their benefit, then they're going to come after you. So you always need to know that. I'm not going to sit here and say you can't trust insurance companies. Okay, yeah, I am. You can't always trust insurance companies. But one of the things I'm not going to cover, just to mention this, is I'm not going to cover diagnosis coding. The reason I'm not doing that is because, one, I'm not a certified coder. 2, back in the day, we had about 16,000 codes, and it was relatively easy. And I never coded, but I could read a medical record and talk with medical record people or talk with the folks down in the department, because that was easy to do. And I had a manual, so I could do that. Well, then we changed to ICD-10, where there's 111,000 codes. And I said, okay, nope, I'm done with that. So I'm not going to talk about that, but we are going to still talk about the process of talking with different folks about medical records. Medical records and privacy is a big deal. However, if you're a revenue cycle person, it's some of the things that sometimes you need to know to be able to talk like you know what you're talking about to both medical records and the folks in the department. So it's just something you need to know. But no, we're not going to get into coding specifically. Then we're going to talk about why, how you talk to insurance companies to get the information you need, even though it's not always insurance companies. because that used to be a thing that I used to work on all the time, where I had a small department at one place. I could say, look, you're calling these people all the time asking these questions. You should get to know their name. You should get to understand what they're going to ask you for. And you need to know what you're asking for. And if you get an answer you don't understand, you need to know how to keep asking the question until you understand what they're saying. And if something sounds totally against what you're used to, you have to know how to ask them for certain information. However, you also find out that sometimes it's totally different entities depending on what state you're in. For instance, when I was consulting in Pennsylvania, I found out that compensation was actually managed by the state, not the insurance companies. So if you had created new charges in any department that dealt with compensation issues, you had to send those charges to the state. But the hospital didn't know that. So in essence, they had almost a year and a half worth of charges that had never been paid. Those accounts were sitting out there because compensation charges can last for a good long time. And they just assumed that they were, in litigation, and that, that was the reason they weren't being paid. They weren't being paid because the state hadn't approved it. So, and of course, once again, if it's not costing them anything, they don't tell you that unless you ask the questions. So that's a big deal. You have to learn. We're going to talk about how you watch out for fraud. And that even includes if someone in a position above yours is trying to get you to do something that you might question and say, geez, I don't know if that's necessarily legal. I've done that as a consultant. As an employee, I never had anybody ask me that question because I made sure that I was always talking about what the proper processes were. And of course, at one point, I was also the compliance officer. So they couldn't tell me to do stuff that maybe they didn't know was fraud or whatever, because as compliance officer, I would report directly to the board. And that was a key in my even taking the position. Just something to think about. And so, we talk about compliance issues. There's a lot of compliance issues across the board. For instance, one of those compliance issues that I stopped the hospital from doing in one of my consulting things is that they were just adding a charge every single time they did specific procedures. And I said, do you have like a written notice from the physician to do that based on these? He said, no, we just always do it because we think it works on the patients. I said, you can't just do medical procedures on somebody. Especially one that's generating $20 million a year. You can't just do procedures on people unless it's documented by a physician that it's something that you can do. You can't do it. And they fussed with me. I said, look, this is just a rule. Someone comes in here and finds out you don't have physician's records, you're going to get burnt on it. So that's something. You have different things like that you need to talk about. So how am I going to present the information? Well, on a membership site that's a blog format, and I'm saying WordPress format, you're going to be seeing written stuff just like you might see on a blog. You're going to have videos. We're going to have PowerPoint/PDFs where you can download stuff and write notes in, because I hope to do some live presentations. I'm going to do live presentations. But I may, do videos so that you can do it that way. But I'm also hoping to set up 30-minute Zoom calls where we'll see how many people come in. I have a Zoom account, but I don't have a paid Zoom account. And if this shows to be worth it, then I'll just pay for the Zoom account. And that would be a once a month thing. Because I think that it helps to have like the feedback back and forth. I get to say some stuff. Y'all get to ask some questions. That would work out pretty well. It may even be some MP3s that you can download. I have to think about that one because I've never really created an MP3, but basically creating an MP3 just says you create a video, then you convert it to an MP3. So that could happen. That way you can download it. But the idea is that with certain things that I put out there, you'll be able to download some of that stuff. And if you stay a member, then you'll always be able to come back and access that stuff so that you wouldn't have to. Although I would still recommend that some of that stuff you download, some of that stuff you print out so that you have your notes. And one of the things that's not going to happen is that I'm not going to start at the beginning, so to speak, of every single category and do like a step-by-step. I think that you can't basically do that because if you're going to do that, you might as well do a book. So it's going to kind of jump around to different things. I think that it helps to get a better understanding of how things work across the board. And you're going to learn about everything. I mean, I've got nothing to hide. So I'll share it out there. But if I just stuck with, like, if I talked about registration and for the first, we'll say 2 months, all I talked about is registration, and you don't work in registration, you're going to get bored. You don't want that. So we're going to move it around. And that's how the access to privileged information is going to work. So we're going to do that. And the content, just so you understand, not everything is going to be long. For instance, if I give you a tip on how to do something that's going to make your hospital work better or your procedures, and I plan on trying to do that with the first 3 or 4 things I put out after I talk about the general stuff, then it may be short, but it may take you a while to do it. In which case, it does me no good to talk about it for a half hour or an hour or write some really long thing. I give you the steps on what you should do, and then you go to your entity, your facility, and you find out, okay, is this something I can do? Now, if you're taking some of this course stuff and you don't already work in a facility, then you get back to me and I will explain that in more detail. But overall, it's still going to be something short that if you're not in a facility, you're not going to be able to replicate it overall, but still information you need to know. My thought is that I want to hopefully have between 8 and 10 items already set up when the site goes live so that folks can see what it looks like, and we go from there. And then I'm hoping to add 4 to 5 new items every single month for at least a couple of years. And then after that, we'll see if I get questions on something that I haven't addressed yet. But I hope to always be able to continue the Zoom thing once I start it. And I also want to see how I set up the forum process. What I believe can happen is that I set up basically one general question or one general post and say, okay, if you have questions or there's something you want me to cover or something you want to put out that asks everybody what it is, then put it here. And I would create one of those once a month, and then we'll see how that goes. Because there's these things where if y'all know what forums are really like, it gets really unwieldy and it's hard for one person to do that. But if it's in one contained place, which is on the blog, it's a lot easier to handle. So we'll see how it goes. And because of the topic, we're not going to get a ton of people who know nothing about healthcare coming in. I will have my spam filters set up, so if the bots come in or if the Russians are trying to break in or whatever, we will take care of those and get those folks out of the way, and that should go pretty easy. And then the only thing to worry about after that is the monthly billing process. And I could set it up where it's automated to do a recurring thing, but I decided, you know what, I'm not in the mood for that. So what's going to happen is that I'm probably going to be changing the passwords at least once a month, and it goes over to the next month. I will send you email because you're gonna have to give me your email address anyway, and I'll send you an email so that you know when it's time to pay for the next month. If you decide you don't want to, okay, that's fine. We remove you from the list. If you decide you do, the link will be there so you can go ahead and you can pay that to my business PayPal account, and we move on. That's really it. I try to simplify it as much as possible so that it works for folks who sign up and it works for me as the person who's going to be creating the content, talking to everybody, doing the education, but also managing the financial aspects of it. That's my thought. That's how I hope it all works. So yeah, this turned out to be kind of long, but it had to be long because I want to make sure that if people sign up for it, they know what they're getting. That's what we got. Anyway, my name's Mitch Mitchell. Y'all let me know what you think off of this. I'm going to also paste this on LinkedIn after a few days when it goes live. And so we'll see if anyone has anything to say there. My name's Mitch Mitchell. Y'all take care.